Welcome to School of Reflexology. Today we're going to be doing a somewhat practical approach as we look at the mop of the feet, and we're going to look at how on the map we are able to differentiate the different reflex points. So we would have gone through the brain reflex, the eyes, the sinuses, the inner ear, the pituitary, the pineal, the nose, mouth, and the teeth reflex points on the chart. We have learned where these points are. So just as how you see these dots, you would use the big finger to hook within the sinus reflexes. You'd have used the walk process to walk over the top of the brain area. You'd have used the hook reflex technique for like the inner ear and the eyes. But now we're gonna see how we're gonna walk like a hashtag sign over the heart reflex. So you go vertical, make some lines, at least 3 to 4 imaginary lines walking through the heart reflex, and then you do it on both feet, but you do foot one, all of the reflex points, and you move over. So you don't do heart on the left and heart on the right. You finish the complete process on one of the foot first. So here we are at the heart reflex, all right? And you would understand the importance of the heart. It is a heart that we use to tell that we are alive. We can lose other body parts like a kidney or an eye, or lose a sense of hearing. But we need the heart to keep the blood going through the body. We need the heart to function to send the blood out of the heart to the body, back to the lungs, and the cycle continues. So we see that the heart and the lung has a lot of cardiopulmonary. They put them together sometimes because the heart and the lung are twin sisters. So the heart pumps blood throughout the body, controls your heart rate, and maintains blood pressure. Your heart is like a bit, your heart is a bit like a house. It has walls, rooms, doors, plumbing, and electrical system. So you hear about the heart valves, right? You hear different terms used. As you hear about chambers, you hear about different parts of the heart. So I want for you to research and send me the copy of a heart and the different parts of the heart that you can keep in your library, your e-library. Send me a heart that you search for and you are able to see the different body parts, the different parts rather of the heart. All parts of the heart work together to keep blood flowing and to send nutrients to other parts of the body. So now we understand that the heart is able to send nutrients because the blood nutrients are in the blood, and so the blood has to go all the way around and around and around. How many miles per day? So we have the aorta, the vena cava, we have the pulmonary valve, pulmonary arteries, left atrium, aortic valve, mitral valve, and septum. So hear me call the names. So you're gonna look on a chart and to see how this heart that is in our chest is able to function and to connect, to send blood from the lungs back to the heart, back to the body, and the cycle continues because the heart is like a muscle, right? So you have the cardiopulmonary, remember that word. You also have, notice that they just don't focus on the name heart. It's all about cardio. So the cardiovascular, heart and vein, You'll hear these terms often used. Your heart main function is to move the blood throughout the body. So your heart rate can be found in different pulse points in the body. I want for you also to research and tell me the names of the different points from head to toe that you can put your hand and you can count the beat of the heart. I want it to be interactive tonight. So in the heart is a nervous system. That's how reflexology comes into play. Your nervous system helps to control your heart rate. It sends signals that tell your heart to beat slower during rest and faster during stressful time so that the body can send the nutrients out. The endocrine system on the heart. The endocrine system sends hormones. These hormones tell your blood vessels to constrict or when to relax, which affects your blood pressure. Hormones from your thyroid gland can also tell your heart to beat faster or slower. Your heart is located in the front of your chest. It's slightly behind the left of your sternum, which is your breastbone. Feel your chest. Put 4 of your fingers right there. You find the sternum, right? And remember, your rib cage protects the heart. What side is your heart on? Your heart is slightly on the left side of your body. It's between your right and left lungs. The left lung is slightly smaller to make room for the heart in your left chest. How big is your heart? Every heart is slightly different. Generally, adult hearts are about the same size as 2 clenched fists, and children's hearts are about the size of 1 clenched fist. What are the parts of the heart? Walls, chambers, valves, blood vessels, electrical conduction system. So the chambers represent the room, the valves, open and close, represent the door, blood vessels represent plumbing system, and electrical conduction system, electricity. So the heart is like a home. This is so unique. Your heart walls are muscles that contract by squeezing and relax to send blood throughout your body. A layer of muscular tissue called the septum divides your heart walls into left and right sides. Your heart walls have 3 layers: endocardium, myocardium, and epicardium. So when you hear the word cardio, cardi, it's heart. Endocardium, inner layer. Myocardium, muscle layer. Epicardium, protective outer layer. The epicardium is 1 layer of your pericardium. The pericardium is protective sac that covers your heart. It produces fluid to lubricate your heart and keep it from rubbing against other organs. All right, so these are some important things concerning the heart. The blood vessels. Your heart pumps blood through 3 types of blood vessels. The arteries, which carry oxygen-rich blood from the heart to your body tissues. The exception is your pulmonary artery, which go to your lungs. Veins. Veins carry oxygen, pure blood back to your heart. Capillaries are small blood vessels which carry out oxygenated capillaries are blood vessels which your body exchanges oxygen-rich and oxygen-pure blood. So it is in the capillaries that they exchange, all right? They have the arteries which carry the blood to, and the veins which carry it back to the heart. So that's it. With a patient with poor circulation, they need the flow, they need the techniques, the warm-up techniques help to get the blood start flowing and to get your brain and your heart to start cooperate with you to get the organs being nourished. You have the electrical conduction, my highlight for the heart. Your heart's conduction system is like the electrical ring of a house. It controls the rhythm and pace of your heartbeat. It includes the sinoatria, which we call the SA node. It sends signals to make your heart beat. The atrioventricular node carries electrical signals from your heart upper chamber to the lower. Think of a Christmas light, huh? Making the blink, blinking here and blinking there, sending the message throughout the electrical system. Your heart also has a network of electrical bundles and fibers. These includes left bundle branch, right bundle branch, bundle of His, Purkinje fiber. So the left bundle sends electric impulses to your left ventricle. The right one sends it to the right. Think of a house being wired, and from the main box, light goes to the bathroom, to the kitchen, and you can tell that wires are being run in the roof. Depends on how your country do it. And then you have the bundle of His sends impulses from your heart to the Purkinje fiber, which makes your heart contract and pump out blood. So remember to search for the picture of a heart and replay this video and see what I'm saying. All right? So there are disorders of the heart. Persons might have what is known as arrhythmia, heartbeat is too fast, cardiomyopathy, unusual thickening, enlargement, or stiffening of your heart muscles, congestive heart failure, when your heart is too stiff or too weak to properly pump blood throughout your body. Coronary artery disease, plaque buildup that leads to narrowing of the arteries. And then you have heart attack, sudden coronary artery blockage that cuts off oxygen to part of your heart muscles. You also have pericarditis, inflammation of the lining of the heart. So anything that your patient is having and you're in the reflex and you're walking up and across this area that is shaded and the patient complains 1, 2, 3 sessions, they need to see their doctor and he needs to do a check on the heart, okay? So you tell your patient to check their doctor, avoid alcohol, eat heart-healthy diet, exercise, limit sodium that sends up the blood pressure, manage stress by getting reflexology often. So right there off the bat, one of your best case are people with high blood pressure or stress, okay? One of your best clients, reflexology will be able to help that person, all right? We go down to the shoulder reflex. We're looking at the points that are in the second quarter. So we have the shoulder reflex. So we'll walk this up and walk it across, and then we will use our 4 fingers apart from our thumb and go down into that purple area under the toes and circulate with a circular motion to de-stress that person. It's as if you're kneading their shoulders, okay? So that's the shoulder ridge. So when you're doing that, the person who comes in now, so they feel so stressed and their shoulder is tight and they just can't function. So truck drivers and taxi men and people who spend a lot of time at their computers, they are prime clients for you. Then we look at the bronchi. So the bronchi and the heart reflex is basically near the same area because now we're looking about, think of your throat, you're swallowing, and you know, you have the trachea, you have the bronchi, they're just below the neck area coming down, right? And so that's the area in shaded that you will stimulate, and patients with respiratory issues will tell you that they're having serious discomfort when you press those areas. You gotta be keen, because sometimes it's the heart and sometimes it's the bronchi, all right? So you got to be keen in assessing their health history, all right? Then you have the lung reflex. The lung reflex is shaded in red so that you can walk it up, walk it across. And patients with a lot of mucus, sometimes you'll find like a hard area or a lot of lump or grainy feeling when you're going through this point. So now with this lung reflex, you will have to do snow plow for the front of the lung, because you have front and back lung, which is basically posterior and anterior lung. That's why when you go to the doctor, you notice that they would often sound you at the back. Tell you to breathe in, breathe out. They're testing to see if all is well with your lungs. It's not your heart that they are checking. Basically, they are checking for your lung health, okay? So that is very key component, all right? So now I am going to also look at another real life situation of clients that I would have seen and their situation that would have come up. All right. So I'm going to give you the health history and then we go in. So I'm going to now share a diagram from a real case that I saw recently. Okay. These are case studies for your benefit. So this is a young professional. She's pregnant. She reported that she was in and out of hospital bleeding, thought it was a miscarriage. And so I asked her a certain question as it relates to kidney stones, because when I went into the reflex of the kidneys, part of the kidney reflex is in this area, the adrenal gland and the kidney. In this area, she was having a lot of pain. Then she told me that they found kidney stones, but they're wondering if they were passed out while she was bleeding or seeing blood in her urine. Her pituitary gland, they were very active and painful. She's pregnant. So you will have to understand the function that I told you in the last class of the pituitary gland, how it is able to send functions to every gland in the body. One of the glands that we did mention is the mammary gland. That's for persons who are pregnant and the body need to prepare itself for breast milk, okay? So the breast milk needs to be processed, and so that gland will be active. Then her sinuses were very active. Here they are at a ball of the toes. They were so active. And in that, she said she have been passing out a lot of mucus confirmation. Then her eyes, she wear glasses. Then her inner ear, yes, she has itching ear. Her shoulders pained because she was pregnant and she also was still at work. She had a lot of pain in her neck reflexes, and I put them here in the toe. So this is where you'll draw some lines and report the patient pain response for the neck. So I was going between the toes. So I put some squares there and she said it was a 4 out of 5 pain. All right. Then, because if you notice, based on the chart, we kind of separate the neck issues on the dorsal chart. We put it down here. Then also here, the base of the neck, she had a lot of pain. And she had constipation, bowel issues, pain response was a 4, all right? So those are key. I'm also gonna show you what her results looked like when she returned for her second session. All right, so you understand how persons respond to the different sessions. All right. Okay, so you got to remember now, you use different signs to mark: squares for pain, hashtag for hard area, right? So that's some ways you're able to mark it, right? So I'm looking for her first and her second visit, right? So I found the one before delivery. I'm going to show you that one. That was the third session she did before her delivery. So here it is. You would have seen the first one, very busy. Now at third session, still had pain in the kidney reflexes, still had some shoulder pain, eye pain, and her arm reflexes were painful. Now I asked her to show me, send me a photo of her prenatal meds, because I wanted to find out if she was getting enough calcium while she was having so much joint pain. When she sent me the text, there was no calcium in the supplement. So the baby was getting it from anywhere she could, pulling it out of her bones to get it. And so she will now have to be on calcium for recovery. All right? So that's very important. All right? I have another exhibit to show you of another patient who came very stressed. I'm going to show you what the chart was, and then I'm going to show you what it was after. All right? So you got to bear in mind that people have a lot of stress. And so we got to be there for them and encourage them to try it. Try. Nothing beat a trial. All right. Here is a patient, very stressed. Had a conversation like a week before, and he said he was having anxiety attack. He's an accountant, has about 11 clients to deal with, and very stressful time. He has different engagements in terms of ministry. So his sinuses were very active, his pituitary gland, his pineal gland, his throat reflexes. He had a lot of pain at the base of his throat. His lungs were congested. Thymus gland, that is a part of the immune system, was painful right along here. He had a lot of pain. When he did the breathing exercise, which I'll show you for the diaphragm, when I do live classes, they were painful. He was having so much pain. But he said after the first session, when he went home, the sinus that used to drain so much did not drain. And he was like, okay, I'm waiting to see if this thing is real. And so he waited in vain because he automatically felt better after his treatment. When he came for the second treatment, I'm going to show you what his results look like. He said the pain, the discomfort was not there. His sinus area, like it was freed up. I took him off cheese and dairy products for that week, and he said he felt much better. Reflexology works, all right? So that's one case, all right? Next case, I'm going to show you that of a little girl who complained to her mom of stomach issues, and they had to take her to see the doctor. All right, so I'm going to look for that one. All right. Okay, here we go. So be observant, and you're going to learn to make those squares and those hashtags. You'll do it a little neater. after a while in the profession, you get so used to what you're doing, you just move fast. But I want you to do it in squares, in hashtag forms. So the client, 9-year-old, eyes painful, lots of green in the shoulder reflex, diaphragm area, lots of pain, stomach area, lots of pain, intestine, hard, lumpy feeling, which is right along this area. Ask about her diet, poor diet. Don't eat a lot of fruits and vegetables, a lot of fast food, a lot of sodas. And she could have picked up a bug because they ran several tests days before and they couldn't find nothing. Also, take note, her over-uterus reflex, she had a lot of pain. She said it was like 3 out of 5. When I asked how old she was not yet ready for a period, but I told them prepare because the body is getting a signal that it's ready, something is happening there. Normally when there's pain there, the person has fibroids or a period is about to come, signals come because they are neurologically sent. She had neck pain, she's on her phone a lot. She had pain in the T-spine, which runs straight into the stomach. So I'm awaiting her medical confirmation as to what was happening there. All right, I'm going to look at one more. See if I can find one more case. That is quite interesting. And all these researches were done to give you a current update as to some of the cases that I did so that you could have a true to life experience. This patient is 72, somewhere thereabout. She has eye issues in one eye. She has sleeping issues. She has hormone issues based on the findings. She has constipation issues based on her subjective information. Subjective means the parents told you. Objective, the patient rather, is who told you in the subjective data. Objective is what you observe. So the patient's pituitary and pineal gland had a lot of pain. Their eye reflex, their shoulders, they bake a lot. Their adrenal gland reflex, their stomach, their constipation, anus rectum, ovaries, sciatic nerve point, neck, they were very tight. And so I recommended for her to see endocrinologist to see what's going on and to see if they need to give her hormone replacement. So to date, my patient who was due November for baby, she had baby 2 weeks or more before the time they gave her. She had baby last week, Saturday. Now she came for reflexology 7 days before because I knew the baby was coming based on how she said she was feeling. So I gave her intense treatment the last time by applying a lot of pressure in the over-uterus and spine reflexes. So that message can be sent to the brain, look at baby's hair, do everything to stimulate oxytocin and whatever it will take for them to induce, for the body to induce its own drug, because the brain has its own pharmacy, the pituitary gland, that's a pharmacy. All the major drug you hear the name, it's mimicking a chemical in the pituitary gland. And she went in after 7, and after 8, the baby was born. And she was able to text me to say, baby born. I'm like, really? Same day? So you know reflexology work. I hope this chart was of great help to you. And so now you will have to get your family member, call me, position the camera where I can see you, and you will need to show me your concept, what you have learned, and do some of the relaxation techniques and walk me through the first 2 parts of the feet. So this is section 1, section 2, section 3, section 4, section 5. We're now at section 2, the organs in this part of the body, right? So I walk you through So you're now going to read yourself through on the organs in this area, the heart, the lung, and what makes up the respiratory system. All right? I hope you have a great evening.